Hi everyone, it's Yaz from Yorkshire Peaches Therapies and welcome back to another episode of Hop, Skip and a Jump. Today I'm joined by the amazing Nina of Nina's Veterinary Physiotherapy based in Nottingham. Now, I met Nina at the VOA conference earlier on this year and we connected through our complete obsession about hypermobility. Nina is an absolute powerhouse of information on this topic and is holding her own event later this month all about hypermobility for fellow therapists. So I'm going to stop talking. Let's jump into that conversation. Thank you so much for joining me today. Now, we met, it was this year at the VOA conference. It was Drew from Uppsala who said, you two need to talk to each other, because I'd been talking about hypermobility and he said, you need to talk to Nina about hypermobility. So Nina, tell us a little bit about you and how you kind of found your way into hypermobility as a specialty with dogs.
I'm a canine physio. I've been canine physio for 9 years now. I have hypermobility myself, and it took me way too long, embarrassingly long, to realize that dogs can have hypermobility too.
Mm-hmm.
I had a client that I really struggled with the rehab side because everything took longer than it was supposed to. It was a hip rehab case, and all of the plans that I had didn't seem to match up with what was happening with this dog. So I went deep diving.
Mm-hmm.
And then I started learning more about hypermobility and everything just clicked. And after that, I've just been obsessed.
Yeah.
Absolutely obsessed.
It's like when I first trained as a massage therapist in identifying lameness in dogs. As soon as I could identify lameness in dogs, you see it everywhere. And as soon as you can identify hypermobility in dogs, it's everywhere. Out of
It,
interest, sorry, go on.
it's crazy because I get quite a few behavior cases through and there's nothing diagnosed. And everything the owners are saying is going like tick, 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 tick in my head.
Mm-hmm.
And by the time we get to the actual assessment, I already kind of know where we're going to go with this.
Mm-hmm.
And it's crazy because without having all that underlying knowledge, I might have missed that.
Yeah.
And then, yeah.
It's too, I think sometimes we can fall into a bit of a trap. This is anyone working with dogs where we can kind of get a little bit blinkered almost, and the issues in the body never exist in solitary. They're all part of one big moving picture. So to kind of look a little bit more, so the hypermobility, so for people who've never come across that term before, how would you describe hypermobility in a sentence, if possible?
I would say hypermobility is excessive movement.
Mm-hmm.
That's the basic descriptive term of it. There's different types of hypermobility,
Mm-hmm.
but if a joint extends further than it's supposed to, that joint is hypermobile.
Mm-hmm.
So the reasoning behind it can be a genetic issue, so it could be a collagen issue.
Mm-hmm.
We have loads of collagen in the body. With hypermobile individuals, if it is a collagen dysplasia issue, the collagen fibers are smaller, less densely populated, not as strong, and then that causes a lot of laxity, which causes issues with the joints.
Right.
You can also have trauma, so single joint instability, which is nothing to do with the hypermobility syndrome itself, but you could technically say that joint is hypermobile, even though it doesn't have an underlying pathology as such.
Do you find with, because I go off on tangents, digit injuries? So you're here for the ride now. Digit injuries with
Mm.
hypermobile dogs, is that something that you see a lot of? I don't know if I'm biased and I'm finding things that maybe I wouldn't have found if I wasn't looking for it. What's your thoughts on digit?
It's a hard one because hypermobile dogs do tend to injure themselves more often than not.
Mm-hmm.
I don't, the ones I see is not solely digit injuries,
Mm-hmm.
but we do have some digit injuries amongst everything else that we see.
Because it's so multifactorial is the hypermobility. So for me, I first started seeing it in a lot of Labradors and Spaniels, where instead of kind of putting their weight through their foot. It was almost like they were stood on the heel of their pad. If that I'm doing this. This is a podcast. People aren't going to see the video, but like they're stood on their heels and like the pads on the digits flick forward. Like
I know what you mean. It's almost like a C shape of the wrist. So when they're landing, it's not distinct shape of the wrist. It's
Yes.
just more like a C shape.
That's what I started seeing at first, and the more I went looking for stuff in research and textbooks, and I was like, I'm really struggling to find what this actually is. And that's not me saying I discovered hypermobility, because I absolutely didn't. I just don't think there's enough research into it. Would you agree?
Completely agree, because we don't even know how prevalent it is in dogs. We know in human it's 1 in 5. We don't know in dogs at all. Nobody's done the research yet.
Yeah, gosh, I didn't realize it was 1 in 5 in humans. That's
It's
insane.
serious.
That's because I'm hypermobile, you're hypermobile, but we're like different flavors of
Yeah.
hypermobile. But I remember us comparing bruises, because I have always bruised like a peach, and then we were like compare.
And bruising, isn't it?
Yeah, like I could, a dog can run past me and not even touch me, and I might even get a bruise. But what do we know the mechanism as to why we bruise more easily? Is it down to that? Sorry, go on.
It's we're less coordinated as a rule.
Yeah.
So more likely to bump into things. You walk through a door, suddenly the door handle stuck into your clothing because you don't know where the door is in proportion to your body.
Literally all the time. I've got a rip in this hoodie from catching the pocket on the door
Yeah.
handle, because yeah. Oh god.
It, you bruise so easily because you keep bumping into stuff.
Mhm.
Plus, your body has a different collagen constitution than a normal person. I'm just using normal person as a term.
Yeah, yeah.
So if you're more likely to bump into things, your collagen fibers are different, your vascular system might be different, your neurological system might be different.
Mhm.
I don't know exactly why, but I think it's just a combination of everything. You
Yeah.
tend to bruise.
So with because of course I love talking about fascia, and fascia is a predominantly
Mm.
collagen based structure. So when you were saying about like walking through doors and bumping into things because our proprioception and where we are is going to be altered, do we know if that's linked to being hypermobile?
Do you mean the uncoordination?
So when we walk through a door, we'll misjudge where we are in time and space. So is that because we're hypermobile, it affects our fascia structure?
It's more the mechanoreceptors. So
Okay.
you have mechanoreceptors on your joint surfaces, fascia,
Yeah.
all soft tissues, and what they do is they tell you the position of your body.
Hmm.
So if you have your hand, you close your eyes and you rotate it, you will know where that hand is in space.
Yes.
Because our joints hyperextend, the mechanoreceptors are not working the same way. We don't get the same feedback. So if I take a step, I don't know exactly how long that step will be
Hmm.
because my mechanoreceptors don't work exactly the same way as a normal person's would.
So does
So it's that feedback loop.
does that also affect balance as well?
Very
Balance.
much so.
Yeah. So if we were to apply this kind of like back to our dogs, so my dog Rodney is, well, you've seen videos of him, like classic 101
Mhm.
hypermobile boy. And interestingly, he got his diagnosis of hypermobility. I had to take him down the country to a vet that understood hypermobility to get that diagnosis, but there's actually no cure.
No, it
However, it's important that we have that diagnosis so that we can create a plan. So tell me a little bit more about the plan side of things. How would you, if had two dogs, say spaniels, both had hip dysplasia, was standard, normal, and then one was hypermobile. What would you say the key differences between the plans?
I tend to find that hypermobile dogs have really poor body awareness. Their posture is not great, their transitions are not great, their sits are normally sloppy.
Mm-hmm.
So the first thing I do is I teach them how to walk properly, how to sit properly, how to lie down properly, how to move their body in a good way.
Mm-hmm.
I do a lot of body awareness stuff. So we're trying to reduce injury risk, and we're trying to teach them where the actual true end feel of their joints should be versus where it actually is at the moment. And then when we get them sitting properly, walking properly, then we can start muscle building. But what I'm trying to do with all the rehab programs is create enough blocking systems in place
Mm-hmm.
that we're not reinforcing the bad gait patterns, but we're actually reinforcing the more correct, normal gait.
Gosh, could you create a plan for me? Because my knees, like, they go, whoop, it's like they go
Right. I'm
backwards.
so much better with the dogs than people. Like, I've not done one for myself, but
Do as I say, not as I do. But
really
it's
fascinating case I'm working with who's a spaniel who's doesn't have any issues from being hypermobile, but got referred because there was something wrong with the gait.
mm-hmm,
We found out it was hypermobile, so that's what we've done with her.
mm-hmm,
She struggles to stand still. So what we've done is we've done a lot of just stand still and do nothing kind of exercise programs, which she finds incredibly difficult
mm-hmm,
because the muscles are having to work harder just to stand still.
mm-hmm.
That's why a lot of hypermobile dogs have the happy feet syndrome where they constantly keep moving because the muscles have to work so much harder just to do the basic
And
things.
they'll become fatigued as well, a lot quicker. I
That's
know that I can become fatigued quite quickly. So like I can't like just sit like I fidget all the time, and I find that the dogs that I work with who I suspect are hypermobile are also super fidgety. Now, another thing I remember you saying was when we had like this talk at VOA and we were like whispering in a corner about hypermobility, like, oh my god, this is great. Um, was about GI issues. I'm sure you mentioned about GI issues.
Yeah.
So, what's your take on GI issues with hypermobile dogs?
It's the whole thing about collagen. Collagen is found in everything. So it's found in your eyes, your ears, your skin, your GI. It's in like heart muscle. It's in everything.
Mm-hmm.
So what we tend to find in humans and in dogs that if you have hypermobility, you can also have quite big GI gut issues, allergies, slow gut motility, which I found really fascinating.
Mm-hmm.
So it could be that food doesn't travel through your body in the same rate that it would a normal
Mm-hmm.
person, for example.
Yeah, it's
But
so.
yeah,
I find so when I think of hypermobile dogs, I mean, there's no research to confirm what I'm saying. This is just anecdotally a lot
hmm,
of doodly crosses, cockapoos, and things like that. So if you're looking at cockapoos, or Cavachon poos or anything doodly mix, I see struggling with hyperarousal. I see a
hmm,
lot of anxiety. I see a lot of gut issues. I see a lot of skin issues, and I also see hypersensitivity in stifle, hip, like lumbar, everywhere. And people can sometimes misread, or I think misread the doodly breeds for they're just absolutely crazy. And it's like I think they're really stressed actually, and that's taken me a long time to clock that with my own dog. I just thought he was a busy dog. He's not a busy dog, he's a stressed dog, despite all the things that we put in place. And I do think that is massively linked to his hypermobility.
100% agree. I see a lot of dogs who have so much anxiety, history of behavior issues,
Mm,
don't like wearing harnesses, don't like being cuddled, don't like being touched,
mm-hmm,
have over exaggerated reactions to noise, light, normal stimuli that shouldn't have the same kind of effect.
mm-hmm. And
But
sorry, go on.
oh, don't worry, I just find it absolutely fascinating
It's
that something that is a collagen issue causes so many behavioral issues as well.
so many behavioural issues because they can't verbalize to us that their muscles are feeling fatigued or they're overstimulated. It's up to us to recognize that as pet parents but also as therapists. So why do you think, Nina, that the issue of hypermobility, because I see it all the time, I see hypermobility all of the time, why do you think that this has been missed so much in veterinary medicine?
And I think it's nothing. Some dogs can have hypermobility without an issue.
Mhm.
Those dogs wouldn't even go to the vets because there's not a problem.
Mhm.
If you do have a dog with an issue, they so often have concurrent other orthopedic issues.
Mhm.
So if I have a dog who's hypermobile and has hip dysplasia, the vets are more likely going to point out the hip dysplasia versus focus on the hypermobility issue.
Mhm.
And if you have a dog with just hypermobility but no diagnosable issue, if you do all the scans, you're not going to be able to pick up anything because it's not going to be diagnosable through scans.
Mhm.
So it could just be concurrent issues, no symptoms,
Yeah.
and it's not really that much talked about. We barely have any research in dogs. We have so much more in humans, but we barely have anything in dogs at the moment.
We do have more in humans, but I think as well trying to get that diagnosis as a human is very, very difficult. So I was first kind of made aware of hypermobility at a lecture in Cambridge from, oh my days, Dr. Helen Cohen, who is a resident rheumatologist at London King College Hospital or sort of something to that effect. And she specialises in EDS, put my teeth in, Ehlers-Danlos syndrome. So there's 14 different categories of EDS in humans, and to get that diagnosis of EDS, most of the time people are diagnosed with things like fibromyalgia first, and then you have to rule everything out before we get to that hypermobility diagnosis, or that EDS diagnosis, sorry. And in dogs, as last time I checked, correct me if I'm wrong, there's only two recognised categories of hypermobility. Is that still the case?
I think so, yeah. And there's only real one gene that you can test for.
Mm-hmm.
So if you think about how many subtypes you have of EDS, and there's only one gene that we can test for in dogs, it's going to be missed so often,
So
isn't it?
often. And as well, a thing that Dr. Helen Cohen said was that they believe that EDS is actually a group of genes as opposed to one specific gene, just to make it a little bit harder to find it.
I think the latest one I read, it was 19 causal genes. So trying to figure out your subtype, your category, your gene is going to be really difficult, isn't it?
Very, very difficult. But there's things that we can do as therapists to help identify. So, obviously, we are not in a position to diagnose a condition. However, we can report on a joint being hypermobile or a dog being hypermobile, because that's just us looking and saying, well, that is hypermobile, but we're not diagnosing hypermobility. It's all down to the language, isn't it? That's up to the vet to diagnose the hypermobility, but we can identify a dog being hypermobile. So,
Mhm.
what would you say? We were talking earlier that there's not just one test you can do to see if a dog's hypermobile. It has to be kind of like a collective. So, what would you say are your key points that you'd have to tick off to mention it to the vet that you suspect a dog is hypermobile?
So the first thing is skin elasticity, and that's the easiest one to do. So what you do is you measure the dog from base of skull to base of tail, get that measurement.
Mm-hmm.
You pick up the skin as high as it can go. I normally go around the lumbar region, unless the dog has lumbosacral disease where it's going to be painful. I go a bit further up
Mm-hmm.
and I look at the actual height of the skin fold. And what I do is I do a measurement where the skin fold is divided by the length of the dog and times it by 100, and I get a percentage.
Mm-hmm.
What that percentage tells me is how elastic is that skin.
Mm-hmm.
In normal dogs, it's about 6 to 10%,
Mm-hmm.
but if it's 14 and a half or more, it's indicative of possible hypermobility syndrome or possible hypermobility.
And is that something that we could, like, how do we quantify that in a report? Would we just say skin elasticity is in this percentile, and would a vet be able to recognize that and go, oh yeah, this dog's got hypermobility, or does it need a little bit more for them
I
to translate that?
tend to do a little paragraph saying this is how I measured it, this is what typically is, this is what's been shown to be a little bit higher, because my base assumption is not every vet's going to be knowledgeable about hypermobility, and I want to be as helpful as I possibly can.
Yeah, absolutely. So that'd be your first one, would be the skin
Yeah.
elasticity. What would you say would be like your second kind of little red flag?
shoulder abduction. So I want to look at the shoulder abduction angle.
Mhm.
So in a normal dog, it's about a 33%.
Mhm.
I want to see, is there excessive mobility in that shoulder?
Mhm.
And if there is, it's another tick to the box that, yeah, the dog could be hypermobile.
Nice.
My third one would be looking at the knee, so the stifle. Is the stifle extending further than it would be in a typical dog?
Mhm.
We have that lack of end feel. So, you know, when you normally extend a dog's knee,
Mhm.
you get that point of an end feel.
Mhm.
Do you have a little bit more laxity when you get to the end of the extension?
Right.
And if all three are yes, I'm like, let's get this to the vets and just let them know what we think it might
Mhm.
be going on, and then ask the vet's opinion on it.
So, with regards to a treatment plan, this is obviously going to be so different depending on the dog and any other
Mhm.
comorbidities that we have. Physio
Mhm.
exercises is going to be absolutely paramount. We've already kind of touched on that a little bit already, but would you say there's anything else that we should be focusing on to just best support that dog? Given that there's not a cure, it doesn't mean that we can't have that management in somewhere.
I definitely want the vets on board because a lot of these dogs have a lot of pain that is uncontrolled. And
Mm-hmm.
a lot of the dogs feel pain more strongly and they get a lot of chronic pain.
Mm-hmm.
So I definitely want the vets on board and pain relief on board if needed.
Yes.
You can also do hydrotherapy is fantastic
Mm-hmm.
because it's going to be strengthening the joints.
Yeah.
You just want to make sure that dog's not hyperextending while it's working.
Mm-hmm.
So that's why I definitely normally start a physio program first, teach the dog how to move, and then go to hydro
Yeah.
to strengthen muscles and joints even more.
Nice.
Acupuncture is fantastic for pain relief. So if you do have a dog with chronic pain, acupuncture is fantastic.
Oh, love acupuncture. I love acupuncture. It's fantastic. Um, what was I going to say then about we're talking about we're talking about hydrotherapy. Sorry, I'm having a brain fart. It oh my god, I'm really having a
Hyperextension.
no. You said stifle. There we go. I've remembered now. So Rodney, he was diagnosed with luxating patella at 6 months, bilateral grade 2, and
Mm,
I went and had him CT scanned because I had one vet give an opinion, and he said, "Look, you're doing all of this stuff, but you're not actually dealing with the main issue. He needs to have surgery." So I went and did the CT scan. No signs of OA, and his trochlear groove was beautiful. So his bone framework was absolutely spot on. It was because of the hypermobility. So now his new diagnosis is hypermobility with secondary luxating patella, and that makes a big difference. It makes a big difference to me because I know that Rodney is like a can of fizzy pop that's been shook up and it needs opening. That's him, right?
mm,
And to put him through that surgery, like trying to rehab him through that surgery, he would need behaviour medication to sedate him to keep him still to safeguard the surgery. But an interesting thing that, well, I've seen with people that are hypermobile is the absorption of medication is different, especially with opioids, I
yes,
believe. Yes.
opioids. There's been a lot of research in humans where opioid medicines don't do anything for us. I have personal experience. They
I
don't
do
do
too.
it. Yeah, so when you have a dog confirmed hypermobile, we have no research to say opioids don't work on hypermobile dogs. But knowing that it does not work on humans,
Mhm.
it probably wouldn't be my first point of call for a hypermobile dog.
Yeah, because like when you look at research, because obviously we're having to look a lot at human research, but this is also why it's so important that you've got a vet on board that you work well with, who's open to having these conversations to say, actually, you've recommended this, but this research paper suggests otherwise. Could we maybe explore another option after a 6 week pain trial? Because as well with your opioids, that's going to have in some cases behavioural sedative effects. So is it that the dog's feeling better, or have we just sedated the dog? So it's constantly like spinning 20 different plates in one go.
question is that if you do have a dog with hypermobility where opioids don't work for the pain, they're probably not going to have any sedative effect either.
Right,
Which,
okay. Right.
because in the humans I've talked to who've been on opioids,
Hmm.
there was absolutely no effect.
Right.
So it's an interesting conversation. I'd love to get research on it. Like I would love to get research on dogs and opioids. Like I would love
Yes.
it.
It would, if anyone's listening that would like to do something like that, please do, because
Yes,
it'll give us,
please.
it'll give me and Nina more to talk about. So, for those who've been listening and they're like, "Ooh, this hypermobility thing sounds interesting. It sounds like I should be taking a look at this." You've actually got an event coming up that is
I do.
all about hypermobility, and I am so excited. So please tell people about this event that you're running.
It's on Sunday, the 26th of October, and it's held in Nottingham, and it's going to be a whole day talking about dog hypermobility. And I'm so excited. The
Yeah.
hardest bit has been trying to condense everything into just one day because it is such a large subject,
Hmm.
but I'm very excited.
It's going to be absolutely incredible. And I think, have you still got a few tickets left?
A couple, yeah,
We can
just a couple.
just about squeeze a couple more people in. So this is something that I think you're going to have to run again, because I think once you shared your knowledge with the initial group, and then we go out and we talk to all our other therapy friends, and we're like, listen, you've got to go and talk to Nina about hypermobility, and I think you're going to do really well with it. I am super duper excited. Hypermobility is one of my special areas of interest, but it's by nowhere my specialty. I would definitely say this is your specialty, so I'm just there to just soak up as much knowledge as I possibly can, especially when it comes to managing chronic pain in dogs. The more we learn, the more we can help. So
Mhm.
at this so it's going to be a full day course. Is there going to be opportunity for therapists to, you were mentioning about how you measure skin elasticity? Is there going to be demonstrations and stuff?
I'm going to try and get some dogs in. The
Mm-hmm.
problem I'm having that most of the hypermobile dogs I
Mm-hmm.
have anxiety and behavior issues. I'm not going to put them in an environment that's going to make that worse.
Yeah.
So we'll see what I can do. But
Mm-hmm.
if nothing else, I'm going to have dogs that you can practice on who might not be hypermobile, but we'll do our best.
Yeah, I mean, Rodney would be fantastic for the
Mhm.
skin elasticity. However, he has some pretty severe behavioural things going on, and it would just be, I would learn nothing. If I brought my son, I would learn nothing. So, sorry,
It's
guys,
just
not.
thinking so much hand in hand. Like I would love to bring them out, but it's not going to be good for them.
It's
So we'll
no,
see.
he'd find it way too stressful. But that we could find someone potentially. But like you
Yeah.
said, the behavioural issues overlap so much. So Nina, I could literally sit and talk to you about this topic for the next 5 hours. But I'm gonna cut us short there, and you're just gonna have to come back, and we're just gonna have to talk about it again. I think it'd be really nice to touch base after the event as well, and announce your next date when you're doing it again, because I
Yeah.
think more people need to be talking about this. So, if people want to find out more about you, where can they find you on social media, and where can they find information about this event that you're holding?
So I'm on Facebook at Nina's Veterinary Physiotherapy. I'm on Instagram at Nina's Vet Physio. I'm not cool enough for other socials, but you can find more information on. I think Facebook's going to be your best bet. But
Excellent.
I'll repost the event, and
Yes.
very excited.
Very excited. So, yeah, perfect. Thank you so much for your time, Nina. Now, if you have enjoyed today's podcast, please make sure to like, share, and subscribe. Make sure you check out Nina's event and her socials, because I'm sure we're going to see lots more hypermobility content from Nina. For now, lots of love to you and your dogs, and I'll speak to you soon. Take care. Bye.